It took less than 24 hours for the Ford government to cave into parents and reopen playgrounds, yet months and months of nonstop calls for paid sick leave and better supports for essential workers have gone unanswered. And there are growing concerns about entire communities being left behind to bear the brunt of the third wave.
I was happy for people who, advocated for parks for children to be accessible and just to remain open. I think that's a good thing. But it proved that the government is hearing us and is choosing not to respond.
Shocking, painful, ridiculous. That's how equity consultant Kika Oja-Thompson described the Premier's announcement on Friday. She tells me the lack of supports for essential workers is appalling, and she can't understand why the people who need help the most are continuously overlooked.
We ask, what is it? If it isn't systemic racism, if it isn't, that Black lives don't matter and that, immigrant lives and low-income lives don't matter, then what is it? We're the inquiring public wants to know because we're at a loss.
The Ford government has always said that it doesn't want to double up on Ottawa's sick leave benefit, even though experts from all different walks have been saying it's not easily accessible for many people. NDP leader Andrea Horwath took this fight to Queen's Park today, introducing a motion that included paid sick leave and paid time off for vaccine appointments. Every measure was voted down by the Ford government.
The experts were very clear what we need in Ontario to save lives and save the health of our people. Paid sick days, not carding. Will this Premier finally start listening to those frontline healthcare workers and the experts who are pleading with him to do the right thing?
Minister of Health.
Thank you, Speaker. And in fact, what the Chief Medical Officer of Health has recommended, what the Science Advisory Table has recommended, is that we need to have enhanced public health measures.
Toronto's top doctor also weighed in.
We also need provisions to allow people to stay apart if they're ill. This includes paid sick days, even on a temporary emergency basis, so that people can afford to stay home if they're sick. The science supports this.
And this tweet from a critical care doctor reads, yesterday we put 2 young parents on ventilators. They got COVID through workplace transmission. Children need safe workplaces for their parents even more than playgrounds.
I'm asking everyone that tweeted, that sent a letter, made a phone call regarding playgrounds to do that, to do the same action, but make the issue paid sick leave.
And with the latest AstraZeneca news, Ojo-Thompson believes we now have an opportunity to quickly get vaccines in the arms of those who are most in need.
No, not everyone over 40 should be accessing AstraZeneca. We need to make sure that the people that live in the dense areas, the densely populated areas of our province, that they would be vaccinated first. Those that are living in multi-generational households, I mean, we know the list because we've heard expert after expert say it. The question is, why aren't we listening? And who's informing cabinet? Who's informing the Premier?
Every doctor and epidemiologist I spoke to today and over the weekend believe that without shutting down more workplaces and better support for essential workers, such as testing, vaccine, and paid sick leave, this third wave will drag on much longer than it has to. In Mississauga, Shauna Hunt, City News.